morning. Welcome to Viewpoint, your program of personality, politicians, and perspectives. And as always, we have a great personality with us this morning. A couple of perspectives or two. I'm going to call our personality, he's a new man. I'm going to call him Slim Don.
Yeah, really?
My gosh. A young, handsome fellow walked to the front door, and I thought we invited the wrong guest this morning.
Thank you.
Oh, by the way, we upped our listenership from 2 to 3.
Oh,
I know.
We're growing steady.
Welcome to Mr. Brad Nichols. He's on his way now to Petersburg or somewhere over there in Menard County to sell a car or two. It says he listened to us on the way over. Somehow stays out of the ditch. I don't know. Anyway, kudos.
Yes.
And I think this morning, Jim and Judy, by your leave, it'd be just really appropriate to extend a kudos across the room to our young guest here, who stepped in at the last minute and graciously appeared to come here with us, and we're going to talk about a lot of things that are important to people's lives. Rakisha Fallon was supposed to be with us, Lincoln College graduate, and she's doing very, very well in the communications business. And she got a call that she couldn't ignore. She had to go take care of a well-heeled client, and after all, money talks, and she'll be back with us, and for the money we offer her. So, without further ado, Don's check is in the mail.
This cup of coffee is fine enough. I'm happy with this cup of coffee. Thank you.
Why don't you introduce our guest and get down to serious business this morning? We appreciate Don's doing this.
More than you know. You're my new
welcome.
best
More
friend.
than you know.
I'm always glad to be here. You're welcome.
Bless you. Don Cavi, of course, is the administrator at the Logan County Department of Public Health. And his fall newsletter breaks the news about SIU, Southern Illinois University, partnering in the health business with us in Logan County.
Correct.
And so let's talk a little bit about the direction that we'll be taking.
Well, yes, it is a partnership, and I do want to include Abraham Lincoln Memorial Hospital. They have graciously their foundation.
I know about them.
Yeah.
I worked there for 17 years.
Oh yeah. But their foundation was gracious enough to provide a grant for $100,000, which actually helped pay for the medical clinic to go in our building. Southern Illinois was reaching out, and we were reaching out, and they were looking to expand their federally qualified health center. And, when I took over at the health department a few years ago, we had, at one time, and you probably remember this, we had maybe 70 or 80 employees. Now we're down to about 30. So I have space galore in that building, and it made sense. Let's use some of that space and bring a primary care clinic in. We do have a shortage of physicians in the area. We are underserved in terms of primary care and number of physicians. And so it made sense. Let's talk to some FQHCs, and we did, and SIU, our Board of Health, and we all agreed let's bring SIU in, and they're in our building now. And the wonderful part about it is, part of our goal in public health, and one of the 10 essential services, to provide access to health care for individuals. And now that we have SIU in our building, people that typically don't have access to health care can now access affordable health care, and they won't turn anybody back. So we do have the full primary care clinic, yes, in our building.
Can you give us like a thumbnail sketch of what services SIU will be providing there at the health department?
They're gonna. It's really a full range primary care clinic.
Really?
Absolutely. They, lately they've been busy with the school physicals because the kids went back to school. But, they're looking to increase their practice to get people that are looking for a medical home. And they did the research when they applied for the grant through the federal government to go off-site to our location. The research showed there was just not only Logan County, but surrounding counties kind of on the perimeters of Logan County. Mm-hmm. There's about 10,000 people that live in that poverty range. And they also found that the number of patients per physician, I think the ratio is over 1,000 to 1.
My word.
Whereas in Springfield, that ratio, and I don't have the numbers in front of me, but I think it's not near as much as that, maybe a few hundred to 1. If you look at the numbers, the clinic should be doing well, and they're starting to increase in the number of patients they're seeing, but we're still trying to get the word out that people that really, they need a centered healthcare home where they can take their families. We're really hoping people will take advantage of that in this community. So,
will this work like a traditional primary care unit works, in that you'll have Dr. Johnson, and that'll be your doctor that you'll be seeing?
And that's the hope, and I can't really speak on behalf of SIU. I know Iris Wesley was here on your show earlier, and she's their director, their CEO. But I know just from my conversations with SIU, yes, they want to bring in a permanent physician. They're talking to some right now. They're hoping before long they'll have a permanent physician. And right now they have a physician assistant in there, Jessica DeMarco, who does a wonderful job.
Oh, yeah.
And I've personally have gone to physician assistants, and really they do wonderful work, and they can still prescribe and see patients.
So Jane Smith out there on the street, who does not have currently does not have a family physician per se, will be able to make use of your services for a quote, a family doctor?
Absolutely. Just call the health department, and they will be routed to the SIU medical clinic. Now, they do have a couple physicians that are rotating through right now. But like I said, the ultimate goal, to my understanding, is that they want to get a permanent physician in place.
And you're at 735-2317?
2317, 735-2317.
Isn't she remarkable, Don?
Well, that's why I can't
she is.
remember anything. My
Yeah.
Rolodex is full of phone numbers in my head. Oh, dear. Well, that's good news. That's very good
We're
news.
excited about
that's
it.
great
And
thing
we
for
just
the
want the community to get excited about it, too, because...
And speaking competition-wise, and it's really not, our local doctors here at Family Medical Practice, they're just snowed under.
They are. There's a lot of patients they're seeing.
And it's difficult. And they will tell you, I'm sure every one of them sit there when you're sitting, it's difficult to practice good medicine when you have so many to see during the course of a day.
Yeah, and one of the goals we had with this FQHC was to kind of take the pressure off some of these local physicians, because they have a lot of patients that they can't quite get in, or people have to wait a while to get in to see them.
Yes.
And hopefully by having our clinic, it will make it a lot easier that people can they have another place to go.
That's truly
that's
major
one of our
news.
goals.
That's truly major news for the community.
Yeah, so we're really hoping that people will take advantage of that. Even for well child visits, and the clinic won't turn anybody back. They see all major insurances, just like the health department. We
Okay.
take all major insurance, and with the programs that we have.
One thing that surprised me about the health department, you were talking about school physicals and so forth, the immunizations that are available at the health department for birth through age 18 or for adults. And my golly, you've got a real litany going here.
We do. We have a full range of vaccines that we offer, the Tdaps, MMRs, the chickenpox, and I can go down the list. And we've expanded that over the years, and right now we're offering the shingles vaccine for the adults, 60 and over. They say 1 out of 3 adults who have had the chickenpox can develop shingles over time. So I know there's some recommendations out there, and we do offer.
Who thinks of that? I got a shingles shot through.
That's a tongue twister.
Testing 1, 2. My doctor at the VA clinic down in Springfield asked me just on the spur of the moment while we were talking about the sad state of my health, and did you ever have a shingle shot? And I said, well, no. I had them way back when I was a little child.
The chicken pox.
Yeah.
Or the shingles.
Shingles.
Oh, you did?
Oh, that's very painful, my understanding.
Yeah, as I remember that. Anyway, that's a long dear. It's got to be over 80 years, about 85 years back. My memory doesn't go quite that well. But anyway, seriously, he said, I think you ought to, Bill. So I did, just on the spur of the moment. Never thought about that at all.
Yeah.
I bet you advise that, though, don't you?
Yeah, our nurses, they will make recommendations, and and absolutely, and I do know, Medicare covers that. So, and I think that is that would be Part D of Medicare that does cover that. So,
Well, maybe
Speaking of
we better
shots.
hold hands and go get our flu and shingle shots.
Yes, or we just sit here and hold hands in front of goddamn everybody right now. Serious note, getting shots, Judith, it's just seamless over there. You walk in, you're there, you walk up to the desk right away almost, very little waiting room time, and in a few minutes' time you're out of there. You've had your shot. You have a great staff at the window, at the reception window, and of course, Lord knows your staff, your nurses and so forth, do a great job. Got a couple of favorites of mine. They really do. You have a good staff, Don.
yeah, I was lucky when I took over. It's almost 3 years ago. This month was my first full month when I took the administration position. But I was lucky to walk into the situation with the facility we have and the people we have, and so it just made my job that much easier. So
You have a loyal staff there. Some
they're
of them have
terrific.
been there since Hector was a pup.
And then you've
They're
gone through
terrific,
this
yeah.
business of financing, paying your employees. Didn't you have a little moratorium on that for a while, Don?
We're still doing furlough time on Fridays in
they're
the
not- yeah.
afternoon. So
So they're not really working full time. They are,
not
but they
really,
aren't.
not really. We
Doesn't
haven't
the
had to
budget
think.
help you?
Yes, it
The
does.
fact that we've got a budget for some reason.
Yeah. Well, and the issue is that for the last 2 years the state's been behind on paying us. So we're trying to play catch up. A year ago, we were off Fridays completely. So, but now the staff's at least we can be in half day on Friday, and so we're open Monday through noon on Friday, which is good. It's better than not. Than
Right.
being closed on Friday altogether. So, we're hopefully at some point we'll get back to full time. That's
Well,
our
it's
goal.
just absolutely asinine to be in this position statewide. I happen to see you all did two news release the other day about dentists and how far behind they were in their payments from the state. Just absolutely outrageous.
Yeah, well, and that's the reason. Part of what Southern Illinois University did when they came in is they took over the dental clinic because they get a higher rate of reimbursement because they're a federally qualified health center, and so they get more of a rate of return for the patients they see. So it just makes, from a financial standpoint, more sense for them to take over the clinic. We still own the facility and the equipment, and they lease that from us. So it really has helped. And then we've added another exam or operatory room in our dental clinic. So now we have 4. So we're hoping that'll kind of expedite the turnover as far as getting the patients in and seeing the patients. Because for a while, they were about 6-8 month waiting lists to get in to see the
boy.
dentist. So, but yeah, it was hard to actually run a dental clinic when the Medicaid rates were that low. But we found a solution, we think, and although I hated losing the dental clinic and having to give that up, SIU, they have it, and my concern is that we have the dental services in the community, and absolutely we sure do, and thankfully with SIU here we can continue to provide that service.
Is that part of your job, to be the private eye and go out and find some solution to any problem that comes up?
Well, 3 years.
Like the need for dental clinic and service.
Yeah, that was actually, the dental clinic need was identified years ago. I know we've had the clinic now, I think, since 2011. So and I'm thankful for that. I mean, I can't take credit for bringing the dental clinic into the health department, but dental has been a need statewide. I mean, a lot of counties, if you go around, there are a lot of dentists just don't want to accept Medicaid clientele,
Yeah.
excuse me, because they just don't get enough reimbursement to cover their costs. And I mean, we went through that too, so I understand that, and I also understand they have to run a business too. So, but I have to appreciate the fact that before I stepped in that the previous administrator was able to identify that need, and boy, has it been a need, and I'm glad we've been able to address that. We've got a great dentist on staff, and she's got a wonderful staff too. So it's worked out well.
She had a pretty dentist on staff. I have a bad toothache, Jim. Could I be relieved? Don, we mentioned your staff a while ago, and I was very sincere when I made my remarks about such a good staff. How many do you have out there?
Well, now that, with the dental clinic moving to SIU, we have about 30, in the ballpark of 30 employees now. And I do have to say, and this is kind of, it's some sad news, we had a press release out on it, I think about 2 weeks ago, and you may have heard this, but our home health clinic, Home Care of Central Illinois, is going to be closing down at the end of the year. Sadly, we have 6 dedicated employees that work in that department, but with the home health environment the way it is nowadays, a lot of hospitals are running home health businesses, and people that are discharged from the hospitals, it's just an easier progression to go from there right into one of their home health services. So it's very hard to compete with the larger hospitals. Plus, the way the regulations are now for us to operate our home health program and for us to get our reimbursement, the regulations are making it much more difficult, and we just don't have the administration staff in our home health to cover that, whereas a large home health agency can address that issue much better. So regretfully we have to it was a decision we had to make, and we just financially we just weren't staying viable in that area, and as it's great as the program's been over the years, it's very bittersweet. I wouldn't even say sweet, I'd say bitter, that we have to let it go. And the only good part about it is, obviously the financial side, but I hate to lose the employees, and I hate to lose that service because it's been such a great service to the community.
It was a dandy.
It really was.
We took advantage of that when Buzz was so sick. And boy, it was just great. It was just great, and I had heard that rumor and was just sick and wanted to ask you about that. So now we know the real truth.
Yeah. And the good part about it is with the 6 individuals we have working in that program, some of them have other places they're working right now, so they can, I wanted to give them extra time. We're going to be closing down at the end of the year, and so we gave them over 90 days so they can kind of transition. But we have some people that are retiring, some that are have other employment options. So we're hoping that for the sake of our employees, that they'll be able to step into something else. And but it is sad. It is sad, but it's one of those necessary evils you have to do as far as business goes.
Right. For a long time, they talked about a shortage of people working in the healthcare field. Is that still there?
Home health field, or just healthcare in general?
The healthcare field, period.
Well, there is. I mean, I guess you could look at it this way: there is a large demand for nursing, and people that get out of nursing school, they usually have no problems. I talk to a lot of nursing students, and they already have jobs lined up, which tells me that there are plenty of openings. Which, I mean, does that equate to a shortage? I would assume maybe it does, but that certainly indicates that there's a lot of opportunity out there for people in the medical and nursing field. You brought up an issue here that, and I do want to stress the fact that we are losing our home health, though. Doesn't mean we're going to be without home health services in the Logan County, Lincoln area. We have other hospitals and other agencies in this area that can cover the load. So, that was one thing that we really had to look at when we made the decision. So at least our patients can transition on to some other care. So
You and Judy have mentioned the word shortage. We'll have a shortage of income here if we don't make sure we take care of our sponsors. So we're going to take a few minutes break right now and give a nod to our sponsors. Go right ahead, James. with a nod of head and flicking his fingers on the control board. We're right back on the air. This is the program is The Viewpoint, of course, appearing each Wednesday morning at 08:15 to 0900 hours. We have a guest this morning who has a great impact on all of us here in the he and his staff in Logan County, representing the Logan County Health Department, Mr. Don Cavi. We appreciate, again, at the risk of just being obnoxious about it, the time that you kind of changed your schedule and jumped in here for us today, Don. We were going to talk about opioids. Mrs. Busby wanted to cover that, and the whole community ought to know a little bit more about that because it's such an invasive thing.
One little item in your newsletter said that 84% of Logan County 8th graders reported yes when asked if their family has clear rules about alcohol and drug use and the importance of relaying these rules.
Yeah.
I'm happy to hear that.
important.
84% is great, in my judgment. That seems to be high, and I'm tickled to death to hear that figure.
I am too. Yeah, really at that age, kids are more vulnerable, and that's when you can really get the word across to them. If you could let them know the earlier the better, and I was encouraged to hear that too.
What happened 80 years ago? We didn't have these problems like there certainly were. Well, I'm sure they existed, but my parents were pretty strict, and it was yes, ma'am, and no, sir. And what happened?
And I can only speculate on this, but it's a different world we live in now. Kids are exposed to so much more. I mean, even through the media and through the internet, and there's a lot out there, and unfortunately, not all of it's good. And I think some of it does encourage things that
Yeah, those.
And
are
again,
plastic.
I'm just speculating on that, but
But
look
we're
at society
wasting all these
now.
people.
Yeah.
They're not going to be able to be productive citizens if they fry their mind. I tell you, I'm glad I'm not raising kids in this day and age.
Yeah,
It's a
it's
challenge.
not
It's a
easy.
terrible challenge.
Big
And I
darn
think
job.
the media thing is a major impact. These kids see these things and they glamorize them, and they think, "Boy, I want to try that." And
Yeah,
first
a lot
thing you know-
of it's the music that they're that these kids listen to now too. I mean, it's some of the words I don't want to repeat on the radio that you hear on some of these songs. It's just like,
Well, why not? They do it on television.
well,
You see, any given day at high noon,
it is a challenge
I don't want to go
for
on there
parents
because I'm
nowadays.
going to get carried away if I go further.
Are you seeing an increase right here in the Flatlands?
of opioid usage. Oh boy, I think nationwide it's increasing. Illinois has certainly had some major issues. I know particularly southern Illinois has been hit. Southern central Illinois has been hit really hard. We have been impacted here in Logan County with the opioid situation. I mean, it's on the news every month or two. You hear about somebody who passed away of an overdose, and it's just. It's sad, and fortunately, the community is starting to rally around how to tackle this issue. We don't have all the answers yet, but I do know between our community, I know the state of Illinois is coming up with a plan too that they're working on. I do know from a community perspective that the Healthy Communities Partnership through the Abraham Lincoln Memorial Hospital from the foundation. Which I believe is now the Community Health Coalition, but they've been doing a lot with opioids, and they have a committee that has set up a local coalition. It's part of their ATOD subcommittee, which is the alcohol, tobacco, and other destructive behaviors. But they organized a coalition consisting of community members, emergency responders, police, and they're trying to tackle this opioid issue. And they came up with a plan. I don't have it all memorized, but there's basically 4 key areas that they want to address. And number one is increasing education out there so our kids know more about the dangers of the use of heroin. The other thing is harm reduction. How do we minimize the amount of deaths from overdoses of opioids? And the other thing is increased number of resources in the community to help people, either maybe through behavioral health programs or those types of things. And then there's also a safe passages, which I know is another, and I'll talk about a couple of them because we're somewhat involved in a couple of those areas. The harm reduction that I spoke about, a good example of that is training our police force on administering, it's called naloxone,
Yes.
or Narcan is the other word you may hear. But the community has been unbelievable in terms of donating funds and having fundraisers to raise money to help us. And what we did with the funds is we purchased Narcan, and we trained all the Lincoln police and some of the local surrounding police in the county how to administer Narcan. And in addition, the county, for this year's budget, for 2017 budget, also put in some additional dollars, $10,000 to purchase Narcan for the sheriff's department. And I don't have the up-to-date figures now, but I do know a few months back we had it documented that there were, I believe, about 7 lives that were saved from 6 or 7 lives that were saved by police officers who were administering the Narcan. So it's really a community effort. And then the safe passages portion of that is, we're working with law enforcement. So if somebody has a drug problem, an opioid problem, and they want to stop in the police department, they're not going to incarcerate them or do anything like that. They'll just ask them to turn in all their supplies and their the heroin or whatever they have in possession. In exchange for that, they're going to help provide help for these people. So we're working on that as right now. That's one of the community goals. Behavioral health is another thing, and we're really interested in increasing that type of service into the community, and we're looking at ways to do that. I do know in talking to SIU that they're hoping at some point to get a behavioral health specialist to work out of the clinic here at the Logan County Health Department. So that's something down the road that they've been talking about. So we are doing a lot. The big concern now is that now they have all these different synthetic forms of heroin and the fentanyl and all these types of synthetic drugs that are becoming more resistant to naloxone or Narcan. And so, that's been kind of a scare now. And so we really have to educate people, really stay away from that stuff. That's the thing. And, part of these overdoses, to my understanding, is some people that have been addicted to heroin, maybe they've gotten off of it for a while and they were in rehab, but when they get back on the streets, they go back on it and they're taking the same dose that they took before when, they didn't need as high a dose to get, their quote unquote high from it. And that's where, a lot of times overdose will occur, and because they don't realize they're taking too much. So it's really a scary thing out there. And it's important that, parents tell your kids about this, stay away from that stuff. It's dangerous.
A problem, of course, for our law enforcement departments. By the way, we're very lucky, in my judgment, and Judy's too, I know. In our Lincoln Police Department and our Logan County Sheriff's Department, we have some outstanding individuals that are working on behalf of their community, and more particularly the youngsters in the community. It's a very invasive thing. And addiction is a terrible word, whether it's booze or drugs. Chocolate. Yeah, right. Yeah, it's really. You only get fat with chocolate. You don't get But
do they have special emphasis in the schools in the area on telling the kids what this does to you?
I think they do. I'm not directly involved in that, but I know the schools have been doing a really good job of educating. I know we directly are working with tobacco education and prevention, and we are working with the schools on that. So I do think that the schools are making an effort to at least educate the kids about the dangers of drug use.
We had a control program when I was a kid in high school. The principal, if you'd see you smoking on the street, he'd stop his car, whether or knock it out of your mouth. And he got by with it.
That was the olden days, though.
Today,
You do that today, you'd be in
today
jail.
the poor guy would be in jail half the time.
Oh, yeah.
Because, but that's his system worked.
Right.
Respect was the word there. There's we somehow that RESPECT is going by the
It's
board.
just not in vogue.
No. It's
What is the
it's
biggest
changing
challenge
society.
you have there at 3rd Street, Don? You have many challenges there. What would you say would be your biggest challenge
Well, I think right now,
besides trying to find money?
well, that's my biggest challenge.
Sure,
Yeah.
sure, absolutely.
I would love to get the health department back onto solid footing again. Our reserve dollars, I want to get those built up. And, the day I walk away from this job, I want to be able to walk away and say, if we ever run into another budget crisis, we won't have to go on furlough days, or we'll have enough, revenue in our reserves to, So, yeah, quite frankly, I think the biggest challenge for us, though, aside from that and public health, is a lot of things we're talking about now is education and just trying to get, because let's face it, life's all about lifestyles, and health is all about lifestyles. If you're not healthy, it's because you chose not to live that way, and so it's important that everybody in our health department, and I'm not just talking about health education, but our nurses in the clinic, when they see patients, to make sure that their clients are getting their immunizations on time. From an SIU standpoint, let's make sure the kids get their well child visits from our WIC program, make sure that the kids are eating right. We have obesity issues, and that's not only just around here, but it's, statewide. And, so we all have important jobs to do. So, that's I think that all plays in a lot of it. There's a lot of priorities that we have. In addition, I want to make sure that people are making use of the resources they have, because I think there's a lot of people in the community don't realize everything that the Logan County Department of Public Health has to offer, especially when we're working with SIU and we have this wonderful medical clinic that we really want people to take advantage of. And we really want people to get your well child visits. Don't wait till you're sick. If you've got a small kid who's never been to a doctor, get him in, have him checked out, and it's better to prevention. Is worth a lot.
Oh yes.
So
you talk about the obesity issue, which gets talked about a lot. I didn't
Take a walk down the
realize
street.
that kids could take advantage of the WIC, Women, Infants, and Children's program until they were 5. I thought it was for babies.
Well, we do. We do a lot of the nutrition education to the moms. And not only the moms, post-birth, but even, prenatal. So they do a lot of education in that area. And then also they're teaching the importance of breastfeeding and what the benefits are to that. So we have certified counselors on our WIC staff that can work with people, lactase consultants that work with their clients to teach them those benefits. So we are covering all those ends, and I think once kids get to an older age, you can start to educate them more. Whereas when they're younger, really, the parents are really the ones that play a huge part in their upbringing and how to educate them. So, but they have it covered. They do a really good job over in our WIC department. So,
well, and part of the WIC program is to teach people how to eat. If your folks spend a lot of time eating whatever they shouldn't, that's how you grew up, and you're going to eat whatever you shouldn't.
Correct.
Well, there again, I keep going back to this too, where the socioeconomic thing. Having grown up in a time when there was 2 parents in the household, and as the workforce was kind of steady, so to speak, if there was work at all, but you had a family unit. Today, I'd vouchsafe to say that there are many, many, many homes to which nobody sits down to a table together. And that's a sad commentary.
Yeah,
But
yeah.
I'll bet I'm right about that.
Yeah, I think there's a lot of truth to that. I think it's just the way, because you have working parents now, and it's so different. And, even if they have a meal, it's usually, 10 minutes, throw it in the microwave, and then, you're off to dinner. And again, it just goes back to, times are changing. But, the thing is, families can still have a meal together. It's just, the parents, if they try their best to make sure everyone's together and does that, I do believe family time is important, and
Yeah, if they do sit down at the table together, there everybody's got a cell phone in their hand.
Well,
yeah, that's true.
There's a commercial on television where the mother does something magic and everybody loses their...
Yeah. Well, I like the message it's promoting. That's a good message.
It
Exactly.
is. And in the olden days, when my kids were little, we didn't have all those communication devices.
No, we had Tinker toys.
And so, so we at supper time was when you found out how'd your day go and and all of that kind of thing. And you go, even if you go out to eat, there'll be somebody sitting at the table on their doggone cell phone, which I think is terribly rude, because what it says to me is, you people are a bore. I'm going to talk to somebody else.
Yeah.
You're talking, Don. Do you have to go up the chain of command and the politicians? Do you get any input at all from our local legislators? Anybody ever pick up a phone, call you, and say, "How can we help you? Are you doing all right?"
We do get, matter of fact, not too long ago, Congressman LaHood stopped by our health department.
Good.
And he took a tour of it. A very gracious person, had a very nice visit. He was extremely interested in what we were doing and interested in what SIU was doing. He asked a lot of questions. So, yeah, we do. We do get people that will contact us from time to time.
Yeah, we got a young man coming on here next week. I think he makes an effort to stay in touch with his district. Mr. Butler works hard at that.
And he's been by our health department,
it's
too.
Very important because they have to know what the heck's going on.
He did. About a couple years ago, he did contact us, and actually we took him for a tour of the health department, and he too was extremely interested in what we were doing, and wanted to hear what our concerns were and what he could do to help. So.
Well, I think we're probably a little more lucky here in Central Illinois, kind of the breadbasket of things, so to speak. Those folks who live north of I-80 had any idea that we just exist except for money that they can take up there and drop in their coffers. But that's another story, and we can't get Mike Madigan on because he won't even talk to anybody else except himself or maybe Mrs. Madigan. So we'll just forget that idea.
Yeah, I don't think he cares what we think.
Don, let's wrap up here. You have some points that you want to make.
Well, I was going to say that one thing that we are looking at expanding into our services, and we offer a full array of screening services. If anybody just wants to come in and get their blood pressure screened, we don't charge for that. Just come on in. One of our nurses will be happy to do that. But just to add to this, colon cancer is the second leading cause of cancer deaths. And so we are looking at a colon cancer screening program where we'll have kits people can provide samples to us, and we will screen them. So that's something that we're hoping to start doing around the beginning of 2018, hopefully around January. So that's in our plans. I know some health departments have. There was a pilot project on that, and I know some health departments started doing it, and we certainly got on board with that. So that's something to keep an eye on down the road. So. And I just wanted to remind people, too, that if they ever want to know anything about our services, we have our website. It's www.lcdph.org. We have terrific information on there, and I invite anybody to go there. Even from environmental health, that's my background. If somebody's getting a septic system put in or wants to open up a restaurant, they can go on our website, and it'll take you from start to finish. It's kind of a 24/7 resource of what you need to do to begin a business or to have a septic or a well put on your property. And we have all the forms in there and all the regulations and everything. And then any of our other services or clinical services that we provide, we've got all that information on our website. So always invite people to do that. And as always, I just thank the community for supporting us. we obviously we are part of the community, and we thrive on the community, and we want to give back to the community. So again, thanks to the community for their support to the health department.
And you do a beautiful job with
Well,
all
thank
of
you.
it. Now, if someone wants to get their flu shot, their shingle shot, their blood pressure checked, do they have to call and make an appointment?
The nice thing about the health department is we have walk-in clinics, so they can go in anytime they want. A lot of times, depending on how busy you are, it never hurts to call. Again, 735-2317. Call that number, and it never hurts. But absolutely, walk-ins. We don't make appointments, so anybody's free to come in anytime, and
You're
we'll
always
provide
very
the service they
gracious
need.
about that when you just walk through that door for some service.
We're glad to do it.
We always try to come up with a closing comment or two, and I'm going to apologize for this one in advance. I would just simply close that we're talking about health matters. The road to health, if paved with good intestines. Thank you for Viewpoint.